Hey y'all, welcome back for the last episode of MD Tribe of 2020. This week we have Anjali Talwar, who is a second year pharmacy student at the Gregory School of Pharmacy in Palm Beach Atlantic University. She is originally from Miramar, Florida. She's from Indian descent, and we both went to Florida State for undergrad. That's how we met, and she was so kind to reach out about MD Tribe and being featured on the podcast because she noticed that I hadn't featured anybody from pharmacy, which is a big component of women in medicine. And so I'm really excited to be able to feature her and for her to tell us all about her journey, which was far from linear. And I feel that although that's common, it's very taboo to see career changers, right? And so I'm really excited for her to share her journey. She originally thought that she was gonna become a physician, and she got into medical school in the Caribbean and decided like, this is not for me. And after lots of thinking and evaluating, her own life, she came to pursue pharmacy. And so she tells us all about pharmacy and why she decided to pursue that career and how it's been going and how she loves it. And I'm just really excited to share her journey with you. And yeah, so without further ado, here's another episode of MD Tribe. Welcome back for another episode of MD Tribe. I'm really excited this week to highlight the pharmacy aspect of women in medicine. So without further ado, can you please introduce yourself?
Hi, my name is Anjali Talwar. I am a second year student at the Gregory School of Pharmacy in Palm Beach Atlantic University. I am of Indian descent and my hometown is Miramar, Florida.
Awesome. I'm so excited to have you on today. I haven't seen you since undergrad, so I'm really excited to catch up and see how your journey played out and where it has brought you. So starting from the very beginning, I guess since we left off, how has post-grad life, meaning bachelor's, how has life been treating you?
Life was very unique, to say the least. It was a lot of good after graduation because I was excited. I had this new energy. What do I do? I have this degree. What else can I do? But it was also difficult because I had all these opportunities in front of me, but I didn't know which direction to go in. I kind of knew what I wanted at that moment. And so I started working towards it. I originally wanted to go to medical school, and I had started working towards that degree and doing whatever it took to work. I had worked immediately after graduation, actually as a chief medical scribe for a hot ER here in downtown Fort Lauderdale. So that was incredibly exciting. I got to see so many different cases. It was such a rush. And that is what truly solidified for me that, being a healthcare worker was something that I wanted to do. I really wanted to help people and continue to work on that. Since then, I did do a lot of programs working towards medicine, and for some reason, when things are not going to work out for you, the world tries to tell you. And in the word, I read this in or listened to this in an Oprah podcast, was when you're not doing something what you're meant to be doing, you hear it in whispers, in little whispers, and slowly, until, and if you don't hear those whispers, it starts becoming a knock until it's a bang. And then you hit that bang and you're just like, this is it. Like, I'm not supposed to be doing this. There's something else in my life that I'm meant to be doing.
Yeah.
And between the years of post-grad life and starting my pharmacy degree, I started hearing those whispers, started hearing that knock, and I wasn't listening. I was so stubborn. I was like, no, like, what am I don't understand. Like, I think this is what I'm supposed to be doing. And then I got to a point where I heard that bang, and then that was it. And I decided, I was like, I need to reassess my life. I need to reassess what I'm doing. And I decided to apply to pharmacy school. I applied, I got into every school I applied to. And I ended up choosing a school that I felt was going to help me flourish and grow. And now we're here and we're happy and there's no more whispers. It's just all good whispers, all good, all positivity, all smiles. And I am so grateful.
That's awesome. What would you say, I guess, because you mentioned like it was like first whispers and then a loud like, bang, like, wake up, you're in the wrong field kind of thing.
Mhm.
Well, not in the wrong field, but in the wrong position. you were
Right.
aiming for the wrong position for you in a particular case. So what was it like the first sign that was like, okay, maybe becoming a physician is not for me and being a pharmacist is more for what I'm looking for?
Well, so one of the things that I really succeeded in when I was a scribe was in leadership positions. I became chief very quickly. I was a new person, just hired. 2 months later, they were like, "Hey, a chief position opened up. We've nominated you." And I was like, "Wait, what? Me? Like, I just started. I don't really know." And I was like, I really liked it. I liked leading my team. I loved working with people. I loved working with management. And for me, I just felt like that was the first time I realized that, maybe being a physician specifically isn't what I'm meant to do, because I loved working with my patients, but working with my team to help my patients, that specific role was where I really was thriving. And I really made me step back and realize, like, but then I talked to like a couple people. I talked to my parents, and everyone was like, you can always be a leader as a physician. There's nothing wrong with that, and there's amazing, incredible leaders as physicians.
Mm-hmm.
But one thing that I realize now is that it takes a really long time to get there. And I had all this, and I have all this energy, and I'm just like, I want to be able to do it now. I want to grow now. I want to be in those positions now. Um, so that was, I think, looking back, at least the first time I realized, I was like, I don't know. Is this, do I want it? Because it takes a lot. It takes a lot of time to do what you're doing, girl. So I had to really think about that.
Yeah. And I know you told me that you had even gone so far to like start a semester of medical school. Um, how did it feel kind of like, going through the motions, going through the admissions process for medical school and kind of getting to the point that you're like, this is not for me. And, I guess dropping out and changing your career route.
So to anyone who's applying, I think that if you definitely have to work hard. You have to work hard, but when you feel like you're pulling teeth, like, you should never be in a position to beg a program to accept you. I think that you need to know your worth, you need to know your value, and you are valuable. And so if a program doesn't see that, that's just not the program you're meant to be.
Mm-hmm.
And I felt that there was a point where I was so desperate to get in that I was begging programs to accept me. And I was willing to sacrifice so much, but not the good so much. It was the bad so much
Okay.
to get into a program. And the bad being my mental health, my capabilities, my quality of life. And don't take me wrong, pharmacy school is not easy. Like, I'm just up all night studying, I'm working hard. Like, getting in wasn't easy at all. But I felt valuable. I felt that I was wanted. And I think a lot of people who are in medical school and health professional schools right now, and I have a lot of friends that I speak to, they the program that they're in, they felt wanted. They felt like they weren't just a number. They were a student there. They were someone who was going to learn something and develop in the program. When I was trying to get accepted to my medical school program, it didn't feel right. It didn't sit right with me, but I had tunnel vision. I was just like, well, they want me. They're saying that they want me. They're going to put me in this position. They're going to do this, this, this. And I went to an international medical school in the Caribbean, and I'm not ashamed of that. I think that there are incredible students that come out of there, incredible physicians that come out of there. But my program particularly just was not ready to take on students. I didn't do enough research. I just wanted to get in. Like, that's all it was at that point. I had sacrificed so much. I had that tunnel vision that I was blinded by the fact that I'm just going to go to this school. I'm going to throw the money down. I'm going to do what I have to do, and I'm going to get there. And then it's going to work out. Everything's going to work out. And that's the wrong, I think, approach to it.
Okay.
When I got there, that curriculum was not developed. It was not conducive to students. They were just weaning out students. Like, how can we grab and go, get them in, get them out, that kind of thing. There was nothing developed there. There was no structure. There was no remediation for those students who were struggling. And I was fine. Academically, I was fine, but I was miserable. I'm a friendly person, and I had zero friends in that program.
Wow.
No one wanted to talk. No one wanted to sit. No one wanted to do anything outside of studying because everyone was trying to survive. And it wasn't just a matter of academically surviving there, but that island also didn't have a lot going on. So it was like, how do we mentally survive here and physically survive here too? So it was very anticlimactic for me. I got to the point that I had dreamed of my whole life, and I realized that this is not my dream.
Mm-hmm.
This is not my dream at all. And I came back, and I had to I literally came back, and I remember on the plane back, because I didn't even tell my parents. I just packed up my stuff and came back. And I decided that I was going to tell them when I reached here. And I
Okay,
was
so how did they react?
They were really, really supportive. They were really, really supportive.
Okay.
They understood that my dad was like, you worked hard. You really worked hard, and you knew what you wanted in your life. And you got to that point and you realized that you deserved better. And I can't be upset at you for wanting better for yourself.
Yeah.
He told me that, I was crying. I was like so sad, because I was like, I felt like for a moment I had disappointed him. But I realized that would have been more disappointing for him was not being happy, because all they want for you is to be happy.
Yeah.
So I literally was making a list when I came back. I was like, where do I see myself in 5 years? What are my long-term goals? What are my short-term goals? What do I want?
Mm-hmm.
And now let me figure out what I want from that.
Awesome. So after making that list, what, I guess, top 5 things drew you to become a pharmacist?
So it's funny. I always told myself I was never going to go to pharmacy school. I was never going to be a pharmacist. My dad's a pharmacist. So I knew exactly what the profession was. I knew what I was getting myself into. Or at least I thought I knew. That was the big thing. I thought I knew what I was getting myself into.
Mm-hmm.
So like, I was like, no, I'm never going to do it. I see dad working at Publix every day. I don't want this. And first thing, and then we sat down and we talked, and he was like, well, you have all the, like, most of the prerequisites done. You have all the, why don't you just try it, take the PCAT? I was like, okay, fine, I'll do it. And I had made that list for myself, and I was like, I mean, pharmacy fits into those goals of mine.
Yeah.
And pharmacy has been the biggest surprise of my life. If there's one thing to everyone out there, is never say never, because you don't know. You really don't know until you're in it.
Yeah. I think that pharmacy, I think the main conception that we have of it is like, okay, CVS, Walgreens, well, at least here in, like, Florida, right?
Mm-hmm.
And I don't think people really understand what pharmacists do except,
Mm-hmm.
Handle drugs. Can you give us like a brief explanation of what a pharmacist does, and like what role they play in the healthcare team?
Yeah, I would love that. Because you're right, there is such a big misconception. And that was even my misconception, that like, oh, I'm going to go work for Publix for the rest of my life. And I'm going to just fill pills and bottles and slap a label on it and then give it to a patient. That's it. And not to be biased, but I think that pharmacists are the most underestimated healthcare professional on a team, because we go through 4 years of schooling, very, very similar curriculum structure to medical school. We have 3 years of didactics and then 1 year of rotations. And depending on the school you go to, like such as mine, we have rotations in the summers in between our didactics as well. Mm-hmm. So you have a year of schooling, and then you get application over the summer, because we don't get summer classes. But right. Our classes are, okay, go and apply what you did this year. And you're graded on that. Mm-hmm. And that goes for your first summer's community, your second summer's hospital, and then your third summer is going to be when you begin your rotations. So our curriculum is pharmacology, med chem, it's clinical. We need to know exactly what the doctor is thinking and why they're thinking. We need to be 5 steps ahead of them. Because if a doctor comes to us and says, oh, hey, I have this patient that's on X, Y, and Z. This is what they're suffering from. This is what they're doing. I'm interested in starting them on this therapy. What are your thoughts? Okay, either yes, that therapy is what they need. This is the dosing. This is how we can adjust it for their weight, their height, their kidney function, their liver function, or no, that is the wrong therapy altogether, because guess what? They have X, Y, and Z prognosis. We can't do that for them. Let's try a different therapy. So pharmacists, yes, in the community setting, they are the most accessible healthcare provider. You can go to them, you can ask them what you need, and they can answer your questions. They are legally allowed to answer all of your counseling questions, because they should know, because they've gone through all of that schooling. They know these diagnoses and they know these cases. And then they also are good at the community setting, checking to make sure the physician has provided the right medication at the right dosing, the right weight, everything. I've caught doctors prescribing the correct medication but the wrong dosing for a child because of their weight. So you can recalculate that. They can give flu shots, show you how to use your devices. At the pharmacy, I'm always teaching people how to use their inhalers.
Oh my God, that's the biggest.
So yeah, so you're saying that's the biggest.
Yeah, like a lot of people like put their mouth directly on it, or like don't use a spacer. I think I learned that in my first year of medical school, that you're supposed to use a spacer, and I was like, I've never seen anybody spacer in my life.
Yeah, you think it would be common knowledge, but it's like not, because you don't realize that, oh, what that spacer is used for, and then which categories are better off using it for, like elderly and children. Spacers are a game changer. But it's the little things like that. So at the pharmacy community level, we're out there showing people, we're handing them the spacers. We're like, okay, do it this way, do it that way, how to adjust your insulins, things like that. Now, in a hospital setting, the pharmacist can either be a staff position in a pharmacy unit at the hospital where they're dispensing medications and verifying and making sure that, okay, like this is going to that floor. You have different specialists. You have a compounding specialist pharmacist. You can have an IV specialist, a chemo specialist, and they're doing different things. They're even making the medications there in the unit. So that's one big thing. Now, however, the role of a pharmacist has changed in terms of evolving into team-based medicine. So they're going on rounds alongside the physician, the nurse, and whomever else needs to go. And they're out there working the cases side by side with the doctor and developing, okay, diagnosis, what's the prognosis, what's the treatment method that I need to put this patient on? What do you think? Because we're the drug experts. We work so hard to like learn this medication, and physicians work so hard to become diagnosticians. When you put those two brains together, tailoring the therapy regimen for that patient just becomes incredible. And the outcomes come out so much better too. The errors are a lot less. You're more keen to notice the little things because you have two brains working, looking at it from two different perspectives. And the pharmacist role now is even more involved in that. There are residencies out there for pharmacists all over the country at big hospitals and we're getting there and we're doing that. And that's one of my goals as well.
So when you complete your 4 years of pharmacy school, do you have to do residency or it's optional?
Optional. You can it depends on what route you want to go. So there's three main industries of pharmacy. There's community, hospital, and industry. Okay. So industry meaning I'm going to work for companies like Pfizer or Johnson & Johnson to do things like work on a corona vaccine. Or I'm going to work in the community setting where I'm going to work at CVS, Walgreens, Publix. And then the third option being I'm going to work in the hospital setting, either in a unit or I'm going to work on the floor alongside the rest of the team. Okay. And that's where you have to do the residency.
In the last week's interview, I was speaking to a neonatologist, Dr. Catherine Wynn at Winnie Palmer Hospital in Orlando, Florida. And she works with the tiny humans, like 22 to 25 weeks. And so she was saying the same thing, like she'll call over, for example, a neurologist to, help treat the baby for a specific condition that they had, right? And the neurologist will sit there and be like, yeah, usually the dose would be this for an adult or a kid, but your patient is not supposed to be born yet. So let me go get a pharmacist, So it is really cool to see like how the collaborative environment can save a patient's life. also in medical school, they just throw so many drugs at us, and there's only so much you can learn about each drug on top of like all the pathophysiology of the disease itself. So I find it comforting that when I'm thrown into like the actual field, I have somebody that can like double check me, and that we can work together to kind of like make sure we're keeping the patient in the best possible condition,
I agree. I think that it's beautiful to see the way that the healthcare industry has evolved. Um, and there's a lot of people that are not taking advantage of us. And and I can't blame them, because before, going back 30, 40 years, taking a medication, a maintenance med, or utilizing different therapy regimens that we do today wasn't as prevalent. It just wasn't. Like, that wasn't the forefront way, that wasn't the first line to do things. But now, expediting back to the future, it's so different. It's evolved. People are throwing medicines all day long. And that's why I think it's so much more important now than ever to take advantage of your pharmacist, to use them and work with them to treat the patient.
Yeah. I also think that nowadays, I think people have this, I wouldn't say it's a misconception. I think it's a little bit of both, right? So I think people think that we have become more reliant on medications, but I also think there's a lot of new medications that work a lot better for people's conditions. I guess, what is your opinion on prescribing of medications and people's use of it? Do you think that people should utilize the medications as much as possible, or do you think that it is being constantly overused and overprescribed?
So that's a really good question, actually. So I come from an Indian background where Ayurvedic and natural remedies, where we throw turmeric on every bruise. You drink chai for everything. Oh, you have a sniffle? Go make yourself a cup of chai. Oh, get some basil from the backyard and put in your chai. So I get it. Like, I know that utilizing more natural methods that's what I do. I try natural methods first before I even try medications. And I know the world has become more reliant on the use of medications. Pharmacists are very much aware that there's an opioid crisis, and we're just as involved in it as the prescribers are. But we're taught in school non-pharmacology as well as pharmacological measures. So the first thing they're always taught is what are the best non-pharmacological measures that we can offer a patient. So if a patient comes to us in community setting or even hospital setting, it's like, okay, you have high blood pressure. Have you tried decreasing your salt intake? Have you tried decreasing your weight? Let's try these methods first. Or if you're a smoker, have you tried, what ways have you tried to quit first? So we're all about using those non-pharmacological measures first. We don't want to put the patient on a medication unless they absolutely need to. But if they're going to be on that medication, how can we optimize it? How can it be the best medication regimen for them and provide the best measures? And what's the shortest amount of time that we can keep them on?
Yeah.
So I get that there's a lot of dependency on it, and we're aware, and we want to do our best to lessen the amount of medications, lessen the dependency, but it's hard. And as far as the new medications go, we like I said, we have to stay 5 steps ahead. We're always being notified of new regimen changes, new therapy changes, new ways to utilize certain things, what's on the market, what's not on the market, something's been recalled, notifying patients so that we can be the most helpful to that.
Yeah, that's awesome. Thank you so much for that explanation. Awesome. So I kind of want to dive a little bit into your application process to pharmacy school. So I know there's always this, I guess the most terrifying experience people have is, going into something and then doing a complete career change. And I have some people in my class that, for example, I have a pharmacist in my class that I don't think he still practices, but he did. And now he's deciding to become a doctor. And so is it common in your school to have career changers? If so, did you have to explain that process when you were applying?
So it is common with, I think, a lot of healthcare professions, like you're saying, that people have healthcare career changes. one of my mentors, she's a fourth year, she has a student in her class who was an electrician. And he decided, I want to become a pharmacist. One of my friends, he was a game designer. Yes, a game designer. He worked for like EA Sports, and he designed games for a living. And then he was like, no, I want to be a pharmacist. So for me specifically, I didn't really I talked about my medical background, and I utilized that to my advantage as far as the application process goes. But I didn't really want to talk about the fact that I had done a semester of medical school. And not to say that I couldn't, I think they would have been fine to hear about and they would have been interesting, but I hadn't come to terms with what I had done yet. It was more of a personal choice.
Yeah.
I can talk about it openly now because I've developed that confidence. I've developed that I've come to accept that, you know, my journey was different and my journey was a struggle of my own. And now I'm ready to talk about it with the world and tell people what it was. But prior to this, I think I had a lot of like struggles, internal struggles with, you know, this was my journey. Was it okay? Will the world be okay with this? Will the world accept this? Is society all right with this?
Yeah.
And then a while ago, I was like, I'm throwing that idea in the trash. That's trash to me because I'm here now and I'm thriving. And why shouldn't I share that journey with people? And now a lot of my classmates know, a lot of my professors know what my journey was, but they don't see me differently for that. Now they expect me to be better. They want me to be better because they know my potential. And that just forces me to be better. And I think that's great.
That's awesome. And what does your day-to-day look like now as a pharmacy student?
So a lot of students will either work while they're in school, and that's pretty common. A lot of us have jobs as interns. So I started off with as a pharmacy technician with Publix. As soon as I decided that I was going to apply to pharmacy school, I got into the system and I started working because I wanted to make sure I knew what I wanted. And once you start pharmacy school, you officially become an intern for wherever you're working, whether it be a hospital or a retail pharmacy. So currently, I am a retail pharmacist for Publix. Retail intern, sorry. And that means that I basically do everything the pharmacist does except verifications. And I'm always learning. There's new lessons to be taught, new cases to be seen, drug interactions, things like that. And besides that, I will go to school. School is usually 9 to 5 almost every day. It depends on the classes. Sometimes we have an hour break in between, you know, morning class, afternoon class. Some days we have off, like usually they'll give us, sometimes they give us like a day off in our schedule where we only have classes 4 days of the week, but it just depends on what semester you're in, but no classes on the weekends, thankfully, but definitely a lot of catch up. And it's just go to class, come home, relax a little bit, and then get to work and try to stay on top of your material because it moves fast. It moves quickly. Sometimes we go through 1-2 lectures a day, and your first year is usually your kind of rehashing your undergrad years, like, oh, your orgos, your kinetics, your things like that. And then your second year is where they really start drilling in the clinical pharmacology. Okay. So this semester was my first opportunity to do that therapeutics. So I did cardio and respiratory, EENT. We did a little bit of, what else did we do? Oh, a lot of case-based. So when you start doing your therapeutics, you start doing case-based learning. So whatever you're doing in your clinical core classes, you have a class where it's just applications. Here's a case, figure it out, and then present it.
So the patient comes in with this diagnosis, they're on these drugs, like what interactions do they have, or, you know, things like that.
Yeah, so it's which interactions they have, what are the right doses, medications for them, first of all. Why did you choose those medications? What are the correct dosings based off of their whole HPI and their history? Can you analyze their history? Can you analyze their blood work? We're provided with their blood work. Well, first we have to learn to request it. So it's like, okay, request their blood work. What are the right steps? Once you have that, all right, their serum creatinine, their bun, their sodium levels, all of that. Okay, now off of this, what is the next step to do? And then once you have that, you are prescribing practice. So I have to sit there and I have to have a conversation with the patient, do in layman terms, do a SOAP note, do a follow-up note, do all of those things. We're taught all of that. So, and then how do we go? And then how do we collaborate with the physician in order to further this?
Yeah. Do you guys, this might be a very funny question. Do you guys use Sketchy Farm in medical school?
So it's funny that you say that because I have a friend of mine who's in medical school currently, and he asked me, he's like, "Oh, Sketchy Farm saved my life when I had pharmacology." And I was like, "Oh, I mean, if you had a question, you could have called me." And he's like, "Well, I mean, you probably use Sketchy Farm too." And I was like, "No, I don't. I know what Sketchy Farm is. I actually used Sketchy for microbiome when I was an undergrad, but." And I asked one of my classmates that, because I was actually with her when he texted me this question. And I was like, "Have you ever used Sketchy Farm?" She's like, "I mean, I've opened it before, but I haven't really aggressively used it." I was like, "Yeah, I don't think any one of us uses Sketchy Farm." And you would think we do.
Yeah, we did like a collaborative assignment with some FAMU pharmacy students. And I asked her too, I was like, do you use Sketchy Farm? How do you like remember all these drugs? And she's like, you just learn them. And then she had texted me like the day before her exam and she was like, what's the name of that program that you use to remember all the drugs? She's like, I can't remember all these drugs. And I was trying to, find a quick fix or whatever. But
Mm-hmm.
I just think that Sketchy Farm, it gives you the information you need to know, like high yields. But I
Mm-hmm.
feel like if a pharmacy student or a pharmacist were to look at that, they're like, it doesn't cover anything. Like,
Yeah, it's so limited. I think you're right when in terms of like high yield stuff, I've watched the videos and they're great. And like I'm a visual learner, so it's definitely great. If it works for you, it works for you. But as far as from being a pharmacy student's perspective, I just feel like it, this is my job. Like I need to know these drugs like the back of my hand, and I can't be remembering a lion or a tiger for losartan in the pharmacy. You just remember it. I think my version of Sketchy Farm is working at the pharmacy. So
okay.
like, because I'm like learning about it in class. Like for example, I took cardio this semester. I was doing hypertension was our disease state that we were learning. I learned hypertension. I took my exam and I had studied it, did great. Went to the pharmacy actually the day I took my exam for my shift. And this patient comes in and she's on lisinopril, but she has the cough. And
Okay.
I was like, okay, interesting. And then I immediately saw the bottle and I was like, listen, cough, can't do this anymore. All right, let's switch her, call the doctor. She's having the cough. What do you want to put her on? And I always ask the physician, because it's their right first. And he was like, I mean, I don't know. I'm a little busy right now. What do you think? I was like, well, let's equate her dosing. Losartan works the same. Give it to her, optimize it, switch her out, send her me a new script, done and done. And then I counseled her on that. And my pharmacist looked at me and she was like, and I was like, thanks. It was on my exam today, so I remembered it.
That's awesome. It's not like undergrad where you like walk out the exam and you're like, what did I just learn? I don't.
Mm-hmm. Yeah, I thought that so many times walking out of work. I was like, so what was that exam?
Yeah. So I do have a couple questions about pharmacy school in general, like your class makeup. So in medical school now, we're just reaching the point where women have surpassed like the 50% mark, where it's sometimes in some classes there's more women than there are men. What is the
Mhm.
makeup in pharmacy school?
Yeah, we have a lot more women. I would say about 60 to 70% of the class is women. It's definitely above the 50% mark of women and not as much men. So it's like, good job, ladies.
Yeah.
We do have a lot of guys and they're great and they're so smart, but we definitely dominate in terms of the class makeup. One thing I love about my school is I think we're pretty diverse too. My class, well, I'm the only Indian in my class, surprisingly. But we do have a good variety of, Latin, Hispanic students. You have African American background, Black students. You'll have your just general Caucasians, and it's just diverse. It's really nice. In the upperclassmen, we have a lot more South Asians, I would say, more Eastern Asians as well. But they do a pretty good job of accepting people from a lot of backgrounds. And one also good thing I like about the school is, although we're a Christian school, they don't separate that from your own religious backgrounds. And in fact, I think that they do a decent job of being very open-minded towards it and integrating that idea together.
Yeah. And where's your school located?
in downtown West Palm Beach, right on the water.
Oh, that's so awesome. Okay, and do you like, since your dad's a pharmacist, do you get to like bounce questions off of him and stuff like that?
Yeah, actually, at first, when I first started, I was like, no, I don't want to talk to you about this because you're going to grill me and you're going to ask me these questions and I'm not going to know the answer. um, but now my dad has become like a super fun person to talk to because I'll come home and I'll be like, guess what, Dad? Can you believe this happened today? Or like, I gave this many flu shots today. How many did you do? Like, we'll like compete about it. Or if now he actually is, he's actually really surprised because I think my dad graduated from UF and pharmacy school, and that was 30 years ago. And now when I tell him the things that I'm doing, the things that I'm learning, he's like, why are you learning that? And I'm like, because we have to. And that's what's required of us now. We have to be able to be we're at a different level now than 30 years ago, what they were expected to know versus now. So when I tell my dad certain things, he knows what I'm talking about. He's aware, but he maybe isn't as familiar with the depth of what I'm talking about anymore, or the new therapies that are coming out.
Yeah.
So we'll discuss about that, and he's intrigued. So now the conversations have definitely become very interesting at the dinner table.
Oh, that's cool. I am mostly like on the receiving end where my parents are like, what do you think about this? And I'm like, I just took like a 3-hour exam. Like, I don't care. What questions do you have?
That's actually been with some of my friends. Now some of my friends will call me and be like, so I just got prescribed this medication. Do you think this is the right thing that I should be on? Because I don't really think I need anything. And I'll just be like, that's the right thing you need to be on. You need to take that medication. You need to be adherent.
Yeah. Do you get a lot of COVID-19 vaccine questions?
I do. A lot of fun questions, actually. So when COVID first started, people would come in and be like, where's the sanitizer? Where's the wipes? Where's the Lysol? And we'd be at the pharmacy being like, so at one point we didn't know what aisle the Lysol was in. So I was like, I don't know, ask customer service. But now we've just become so be like, yes, it's on aisle 13 to the left, go get it there. But as we've approached the vaccinations being released, like Moderna and Pfizer, it's like, okay, what are your thoughts on this? Will Publix be administering it, or will CVS be administering it? When will it come out? What's your opinion? You know, how do we feel? What are your thoughts on it with my profile, with my health history? Because we're very involved in our patients' lives. And so I have their health histories in front of me all the time. Some of them have comorbidities, some of them come from special populations. And so I understand their concerns about whether, will the vaccine provide them the relief that they need, or will it also provide long-term side effects? And those are general concerns I think everybody has right now.
Definitely. Okay, so where do you see yourself in, I know you mentioned you thought about this, so I'm curious to know, where do you see yourself in 5 years?
So I have 2 years left of school, and after that, I would ideally, God willing, like to be accepted to a residency program. I'm not exactly sure where. I'm very nomadic with my lifestyle, so honestly, wherever the wind takes me. Yeah. So I'm just like, okay, let's do that. I'd like to do that, and I'd also like to do my residency in leadership management within a pharmacy administration. Okay. So a lot of people like to do more, like, oh, I want to be a lung transplant pharmacist, or I want to be an oncological pharmacist. And I'm really open to all of those things. I haven't had those courses yet, so my mind definitely might change, but the pharmacy is unique where it offers a residency that's a combined clinical residency with an administrative residency. Okay. So I get to basically learn how to make bigger picture decisions for patients' long-term benefits. Yeah. And that's something I'm very excited about, because it goes right back full circle to when I was working as a scribe, where I really loved that role of how can I make my team the most effective to help my patients. Yeah. And how can I make the resources be used more? How can I make these rules be more effective, or help and collaborate with other people? That's something I enjoy and I'm passionate about. So I'm hoping that that's where my residency goes, and then we'll see what God has in store for me from there.
Oh, that's so exciting. Okay, so now that you've gone through like the whole process and it obviously wasn't linear, but you're on track. What two golden nuggets can you offer a woman that wants to go into medicine or a minority that wants to go into medicine and is not sure like what career to pick or is a career changer or is interested in pharmacy? What advice do you have to give?
So I'll give one general nugget and then I'll give one specific to pharmacy.
Okay.
So my general nugget is never say no to any opportunity. Any opportunity that comes presented to you, take it and run with it. Whether it's what you want or what you don't want, you won't know until you're running with it. You won't know till you're in it that this is where I'm supposed to be. This is where I'm meant to be. This is what I like. This is what I don't like. You might think you know what you like, but you really don't until you have it in your hand.
Yeah.
So any women trying to go into medicine or pharmacy or any healthcare professional for that matter, I highly recommend just go try it. You won't know. It's not going to hurt you. The worst that'll happen is you don't like it or they say no. That's it. Then you move on and you keep moving on and you keep working hard till you get to the place where all the pieces fit together.
Oh, so good.
So, and then with pharmacy is it's hard, it's tough, it's very different, and you're not going to be respected at first because I think that's one thing that I think we fight a lot for is the respect of physicians and nurses and a lot of other healthcare professionals. But keep fighting for that respect because you're worth it. You're a valuable asset to a team, and you have the ability to help a patient just as much as anybody else does.
Hmm. That's very good advice. I think a lot of, and I speak for physicians, I think a lot of us go in it like we're the head honcho, you know, like with our chin up and all that stuff. And I think being humble and like open to having help and a second set of eyes is always good.
Yeah, I definitely agree. And we're here to help. We want to be there to be right by your side. And at the end of the day, the goal is the same. It's helping the patient. So everyone has to put their egos aside and just focus on that. And that's what's most important.
Yeah. Oh, well, thank you so much for coming on the pod today and telling us all about pharmacy because I learned a lot. I have not had this much exposure to pharmacy. Even in the collaborative environment, it was like nice to kind of get a rundown of like, this is what pharmacists do, and how it works. So, and how the whole schooling works. I had no idea that you had like all that clinical exposure as well.
Yeah, thank you so much for having me today. This was amazing. I've been wanting to talk about this with somebody for a long time. I'm all about getting the word out there and advocating for my profession. So I really, really appreciate this. Thank you.
No problem. Happy holidays.
Same to you.
Bye.